degree in medicine, and for the first 4 years after I finished medical school, I worked with a grassroots NGO in two large states of India, both on opposite spectra of development. One was extremely poor and the other was a large industrial state, which gave me really a very good, so it was sort of a crucible for me for my future career. And then I went to Harvard to get an MPH. I worked in Johns Hopkins University with a large number of NGO programs. They used to call them PVOs in the United States. Came back to India, worked with USAID for some years, and then took 10 years off, but worked on multiple assignments, including a MacArthur Foundation fellowship, a brief stint with UNFPA, and all of this in the middle of bringing up two children. I then worked with Management Systems International, where we looked at operationalizing a scaling up framework. And so I sort of became an evangelist from then on to ensure that scaling up was designed at the design phase of every intervention. In 2010, I joined the National Health Systems Resource Center, where I still work. And two big programs that I led and supported were the ASHA, which is India's Community Health Worker Program, and India's major primary healthcare reform effort, which was launched in 2018. Keeping in touch with what is happening is what motivates me to keep going. So I think that anything worth learning from can come only from interactions with the ground, with community, especially when you're working with community health systems and primary health care. It comes from frontline workers, it comes from frontline service providers in outreach settings, in basic primary healthcare facilities, and of course with the people. At the national level, one often feels removed and several layers away from the actual action on the ground. So we've devised, my team and I, multiple ways of keeping in touch with the field. So we do a lot of phone calls, a lot of interactions via emails, field visits. And I think structured field visits have been a great way for my team and I to keep in touch with field reality. And when I say structured field visits, I think that is really a methodology for health policy and systems researchers, and I'll talk about that a little later, and workshops. And I think this last methodology is not just workshops where they are talked to, but a lot of sharing and learning that happens in these workshops. So those are some of the ways. We also have another avenue, which is we identify local innovations either through field visits or through our workshops. And then in our effort to scale that up, we are constantly interacting with the field. So that also allows us a real good and deep insight into field realities, which enables scaling up of innovations. So I think there was one thing that we learned in COVID and social media, much as I of the generation perhaps that resents its intrusive abilities. Actually, social media helped us to keep in touch with field workers during this time of COVID. So I think that's another way of keeping your ear to the ground, so to speak. I think what I'd like to say is this importance of structured field visits, the way they are planned, giving you sufficient time for interaction with people, with frontline workers, with providers, feedback to immediate supervisors, and feedback to district and state policymakers. And I think a field visit needs to encompass all of this. Too often, it's very much a touch and go thing. Just go into the state, going down into the district, pick up a few meetings here and there, and then come back and write detailed reports. But I think the importance of structured field visits and reflective documentation really, and I think that's a skill that needs to be cultivated. And that's helped us a lot because we have now a decade's worth of field visits and reports that are very useful learning. So I think the field, the interaction with the field and the people through visits and workshops is critical. But unfortunately now what we observe over time, other than government programs which make sufficient resources available for field visits, the donor-funded projects too often don't allow for this process to happen. And therefore, it's all about these really jet-setting visits that just go pick up a few key findings and then they are blown up into glossy briefs, but really which have very little substance and in the end, very little impact on the people for whom they're intended. And I think finally, my third point for those who at the national level who go down, who are supposed to be interacting with the ground and the field to learn more, is to have the patience and the humility to learn from the people they work with. Too often it's about impressing the state policy maker rather than actually learning from the field and obtaining some insights in how to make things work better. So I think those are some of the learnings that I'd like to share, which have helped us enormously and made NHSRC really a legitimate platform from which we can rightfully advocate for policy change. But I think at the basis of it all is that I just love my work. And I think that I work with a fabulous team of people, and we have this in common. It's this shared goal of how important it is to commit ourselves to our work. In our case, it happens to be, and we are very fortunate, I think, in working with community health workers and people and at the primary healthcare level. So that really puts you much more in touch than, let's say, a project that works with a secondary hospital would have. So I think that's one of the big motivating factors that keep us going. I've also been blessed. I think a second major thing that has happened is that because of our insights that I earlier spoke about, we've been fortunate to have policymakers who are willing to listen to us and to help us convert our implementation findings back into policy that benefits states and communities. So I think that's been a big motivation and a factor that keeps us going. How do we keep in touch? I think open access journals. We don't have that much money that we can subscribe to the really expensive journals, and that's been an eternal regret here. And I know India falls within the LMIC, but we don't really have access to these journals. But having access to open access journals and making time to read, I would have loved to have more time. And I think that's one thing that we missed out on, is interaction with academics and researchers, much more interaction with academics and researchers, to actually being able to construct theory and frameworks around our day-to-day implementation work. And I think that's something that I miss, and I wish that we would have had that. It would have probably brought a lot more quality to the kind of work we do. It's the willingness and the ability in terms of skills to engage with all three levels of the health system, the micro, the macro, and the meso levels, or I suppose I should say micro, meso, and macro levels, to analyze critically and to document in a way that enables change. It's not documentation for a publication, sure, that's important, but also documentation that enables change for the people that you work with. I think we also, young researchers need to recognize diversity, complexity, the seeming contradiction, and the influence of politics and health systems. So I often say HPSR is not for the naive, nor is it an area that can make you cynical. I think there has to be a balance between naivete and cynicism, which you need to bring to the table as a health policy systems researcher. A third attribute, I think, is respect for practice. And I think the iterative ability to link together people's experiences with practice and academic and research and policy. And I think, and I've been saying this for many years now, and it just doesn't seem to happen as often as it should, despite the recognition that it should. It's not happening as often as it should. I think an HPSR should have the trained mind of an academic researcher, but the soul and the heart of a practitioner. And I don't think we're still learning enough from practice, particularly this ability to convert tacit knowledge, recognize tacit knowledge and convert it into theory, into frameworks, and bring it to life so that it can be applied across multiple contexts. So that would be, I think, where young HPSR, young health policy and systems researchers need to venture. I think they need to seek mentors, and not a mentor, not the big guru, but I think multiple mentors. And mentors can come from supervisors, they can come from subordinates, they can come from field workers, but an array of mentors that really nourish them, that support them. And so, of course, academic and research mentors, these are often who we turn to in the first place. But I think a multiple group of mentors that can support and encourage young researchers is really critical. And so mentorship and guidance, because I think in the end, that's what sustains you, in addition to everything else that you do, and you have a place to go back to. And I also think having a place in an academic or research institute is important if one is lucky enough to be able to have that. In the area of financing and human resources, I think a lot of work has been done on health system strengthening. But I think we still need to do a lot of work on people's engagement, particularly now with the focus on multi-sectoral convergence. We need to understand a great deal better how to address people's health aspirations and how to make health systems more accountable. So in the area of accountability and multi-sectoral convergence, I do believe we have a long way to go in strengthening global health systems. And an area of, I think, concern perhaps is technology and the role in health systems. And I think that really needs to be studied better. What is its role in addressing population health outcomes and making systems more accountable while ensuring data security and privacy? And the latter two are areas really that not many of us understand. It seems to be a big black box, and the only people who have some access to its understanding are engineers or trained data managers or people who work with big data and data analytics. And perhaps that's a skill that health policy and systems researchers also need to grapple with. Finally, I think keeping the eye or spotlight on equity as the goal of every health system, it needs to be constantly reinforced. I mean, I think even in COVID, we saw that whether it was doing online training for frontline workers or giving access to telemedicine to frontline service providers, those that got left out were the people who had no access to internet, who had no access to phones or tablets, or who lived in internet dark areas. So I think equity needs to continue to remain a focus, perhaps a central focus of health systems, otherwise it will tend to get lost. So to the question of how can health policy and systems research help, is feeding the findings of HPSR back to policymakers and practitioners in forms that are relevant and in forms that are digestible. I think that's I know that we keep talking about this, but that's an area that we are still lagging behind because there's volumes of research being done, but little of it that's fed back to policymakers and practitioners. I think a second way is identifying ways to better engage with actors outside the health system to enable a better understanding of multi-sectoral influences in health. And this is back to where I said about areas where health systems need to focus on, is to understand what are the multi-sectoral influences in health and integrate strategies into health system and policies so that environmental and social determinants, which increasingly have such an influence on population health, are better addressed. And finally, I think we need more studies on regulatory policies at both global and national levels that impact health of populations. And that's a skill set that needs expanding and building upon. Also requires interaction across multiple disciplines. Finally, I think we need, and I'd like to really say in conclusion, is that we need much, much more interaction between policy and practice. I think this learning from practice is still a lacuna, because there is so much more to be learned from practice, and perhaps that would actually offer us much better insights on many, many areas of health systems. And I feel that we could still do a much better job of that. And really, that's where I've focused a lot of my work on, and where I think in the future also, we need to focus on. And so universities need to actually start thinking of practice of health systems. They teach the theory, they teach the frameworks, but now they have to add on the practice of health systems, and that would probably make for a rounding off of at least teaching health policy and systems research.